discussion will be on what high blood pressure is and how to prevent it. I am Professor Debasish Chakraborty, working in Agartala Government Medical College, Agartala, Tripura. Generally, everyone would like to have healthy or normal blood pressure. But what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the wall of the blood vessels, and this is called blood pressure. Normally, in healthy person, it rises and falls throughout the day. But when blood pressure remains high for a long time and left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than normal blood pressure is known as hypertension. And that's the topic today we are dealing with. Well, obviously, question arises, how high is high? When we measure the blood pressure by the equipment called sphygmomanometer, we express it in two components. One is systolic blood pressure, another is diastolic blood pressure. Suppose normal blood pressure is 120 by 80 millimeter of mercury. So here the top value, that is the numerator, is called systolic blood pressure. It is the pressure in the blood vessels when the heart contracts. And 80 millimeter of mercury, that is the bottom value or the denominator. This is called diastolic blood pressure, which actually means pressure in the blood vessels when the heart races between the beats. Systolic blood pressure normal ranges, it is not fixed because throughout the day it changes. Again, it changes from person to person. Even there is sex variations, lots of variations are there. So you must know what is the normal range for systolic as well as diastolic blood pressure. Systolic blood pressure normal range is 100 to 140 millimeter of mercury, and diastolic blood pressure normal range is 60 to 90 millimeter of mercury. So conventionally, if the blood pressure is more than 140 by 90 millimeter of mercury, we call it hypertension. And if it is less than 100 by 60 millimeter of mercury, we call it hypotension. Now, regarding hypertension, sometimes it may be isolated systolic or diastolic hypertension also. Now, nowadays, another terminology is used that is called pre-hypertension. So pre-hypertension is defined as when systolic blood pressure is 120 to 139 millimeter of mercury and diastolic blood pressure is 80 to 89 millimeter of mercury. You know why pre-hypertension is important? You must be thinking that a person is within the normal range of blood pressure, then why we must avoid? Yes, pre-hypertension, this is the warning sign that you may get hypertension in the future. Nearly half of all adults older than age 18 have pre-hypertension or hypertension. Now coming to the overall prevalence of hypertension. Overall prevalence of hypertension in India is around 29.8%, approx 30%. In rural population, it is 27.6%, and in urban population, it is 33.8%. Now, high pressure usually develops over time. It can happen because of unhealthy lifestyle. For example, not having enough regular physical activity, obesity, smoking, alcohol consumption, and stress, of course. High blood pressure increases the risks of heart attack, stroke, coronary heart disease, heart failure, and kidney failure. There is no cure for hypertension, but don't lose your hope. There is treatment with diet, lifestyle modification, and drugs those are called antihypertensive drugs or medication. Now, as estimated, 46% of adults with hypertension are totally unaware that they have the disease. Less than half of those adults, 42% with hypertension, they are diagnosed and treated. And approximately 1 in 5 adults, that is 21% with hypertension, they have it under control. Now, there are certain risk factors which can increase the risk of developing hypertension. First of all, age. As people get older, the arteries can stiffen up and narrow as excess fat builds up. In medical terminology, that is called atherosclerosis. Then family history of high blood pressure, this is also important. One or more close family members with hypertension increases person's risk of developing the condition. Excess salt intake is also known to raise blood pressure. Not eating enough foods with potassium can increase blood pressure and the risk of stroke and chronic kidney disease. Eating processed and fatty food increase fats throughout the body and make the heart work harder to push blood through the body. And due to that, blood pressure again rises. On the other hand, lack of physical activity is also linked to obesity, and further it increases the blood pressure. Another very important factor nowadays which causes blood pressure to rise, that is stress. Knowingly or unknowingly, we are exposed to lots of stress. Reacting to stress in unhealthy ways or not managing stress can also increase the blood pressure. Well, moving on, hypertension does not have any obvious sign and symptoms. That is why it is called silent killer. It puts people at risk for several diseases, from cardiovascular problems to kidney failure, stroke, and even eye damage, and even it may cause blindness too. So, early and accurate diagnosis is very important in the management of hypertension. Measuring the blood pressure is the only way to know whether the person have high blood pressure or not. Generally, when symptoms do occur, they include morning headaches or tiredness, vision changes, buzzing in the ears, fatigue, nausea, vomiting, or it may be manifested with insomnia or sleeplessness. If person is experiencing some of the symptoms, then one should get their blood pressure rechecked. Fortunately, high blood pressure can be easily diagnosed. On May 17th, we celebrate World Hypertension Day, a day dedicated to highlighting the importance of monitoring blood pressure and bringing global awareness to the 1 billion people living with high blood pressure worldwide. The theme of this year's World Hypertension Day was measure your blood pressure, control it, live longer. Ensure that your blood pressure is measured and controlled if it is elevated. Well, we were discussing regarding the several risk factors of hypertension or high blood pressure. Now, hypertension can be prevented because those risks can be prevented and reduced by taking steps towards a healthier lifestyle. What are those? Like regular exercise, healthy diet, quit smoking and alcohol intake, regular blood pressure monitoring, stress management, and adherence to medicine. If blood pressure is successfully controlled with such lifestyle modification, then it might avoid, delay, or reduce the need for medication. So let us have a look at these strategies one by one in brief. First, most important factor nowadays is advised by the physician, that is regular exercise or physical activity. Because we are, all of us, we are busy and we are maintaining a sedentary lifestyle, which is not at all advisable just to prevent hypertension or to get rid of this disease. Regular exercise or physical activity can be a drug-free approach to lowering high blood pressure. Regular physical activity makes person's heart stronger. If one has a strong and healthy heart, it can pump more blood with less effort. So if heart has to work less to pump, the force on the blood vessel will decrease and lower the blood pressure. In other case, as we all are aware that age and weight gain are the two major risk factors for high blood pressure. So if the blood pressure is at a desirable level, that is less or equal to 120 by 80 millimeter of mercury, then exercise can help prevent it from rising as you age. Regular exercise also helps you maintain a healthy weight, which in my opinion is an important way to control blood pressure. One should aim for at least 30 minutes of aerobic activity most days of the week. And high blood pressure level can be reduced by doing regular structured exercises such as brisk walking, jogging, or swimming, etc. So that was regarding the exercise. Now coming to the healthy diet. In our day-to-day life, in our busy schedule, we are not accustomed to eat healthy diet. Rather, we go for the now and then with so many foods which are not at all healthy for us. Diet also plays an important role in controlling blood pressure. A diet with a high intake of vegetables, fruits, and whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through dietary intervention, one can adopt a dietary pattern such as DASH diet or a Mediterranean diet, eating less saturated fat, total fat, getting plenty of potassium, limiting the amount of sodium in the diet, and avoiding alcohol consumption. Obviously, question arises, what is DASH diet or a Mediterranean diet? DASH stands for Dietary Approaches to Stop Hypertension Diet. Now, DASH eating plan recommends eating vegetables, fruits, and whole grains, including fat-free or low-fat dairy products, fish, poultry, beans, nuts, and vegetable oils, limiting sugars, sweetened beverages, and sweets, limiting foods that are high in saturated fat, such as fatty meats, full-fat dairy products, and tropical oils such as coconut, palm oil, etc. Eating a DASH diet that is rich in whole grains, fruit, vegetables, and low-fat dairy products and skims on saturated fat and cholesterol can lower one's blood pressure by up to 11 millimeter of mercury if having high blood pressure. Then coming to Mediterranean diet, what is that? Mediterranean diet is based on the traditional foods of countries bordering the Mediterranean Sea, including France, Spain, Greece, and Italy. Mediterranean diet recommends consume more fruits, vegetables, whole grains, legumes, nuts, and seeds, and heart-healthy fats. Mediterranean diet recommends consume less processed foods, added sugars, refined grains, etc. And Mediterranean diet limits alcohol consumption. So that was regarding DASH diet or a Mediterranean diet, which is recommended in case of for prevention of hypertension or high blood pressure. Now coming to recommendation of reduction of sodium in your diet. Even a small reduction in the sodium in the diet can improve the heart health and reduce blood pressure by about 5 to 6 millimeter of mercury if you have high blood pressure. To decrease sodium in your diet, you can consider tips like read food labels if possible, choose low sodium alternatives of the foods and beverages you normally buy, eat fewer processed foods. Only a small amount of sodium occurs naturally in foods. Most sodium is added during processing, so you can eat natural products, and don't add extra salt. Just 1 little teaspoonful of salt has 2,300 milligrams of sodium. Avoid adding salt to food. Use herbs or spices to add flavor to food. So after exercise, we discussed about the healthy diet. Now, next lifestyle modification you must adopt, that is quit smoking. Stopping smoking helps your blood pressure return to normal. Quitting smoking can effectively reduce the risk of disease and improve your overall health. Now coming to the next important point, which has to be highlighted, that is regular blood pressure monitoring. Some of the hypertensive patients check their blood pressure by visiting doctors, but it is not always possible for patients to visit doctors and check up their blood pressure. So most often, I advise patients self-monitoring of their blood pressure levels. Self-monitoring helps person to measure blood pressure at different times throughout the day and over a long period of time. It also assists doctor to get a more complete picture of person's blood pressure readings at different times. Further, helps us in better prediction of cardiovascular morbidity and mortality rather than single routine blood pressure measures that occur during a clinical visit. Next point to be highlighted, that is stress management. I mentioned earlier that all of us, knowingly or unknowingly, we are under stress. By learning how to relax and manage stress can improve emotional and physical health and lower high blood pressure. Stress management techniques including exercising, listening to music, focusing on something calm or peaceful, and of course, meditation. Last but not the least factor, which we must mention, that is adherence to medicines. A medicine to lower blood pressure may be recommended by a doctor. If your blood pressure is consistently high, usually at or above 140 by 90 millimeter of mercury, in that case, adherence to medicine is very important as it controls your blood pressure regularly. In this context, I must mention that please stop over-the-counter medication for high blood pressure, because it is a common trend nowadays that you go to a pharmacy shop and get your blood pressure checked, and from there you take few of the antihypertensive and you take for some days, then you leave it, so it will be rather much harmful for you. So always seek advice from your physician and monitor blood pressure regularly, and hopefully your blood pressure will come down to the normal range. At last, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adopting healthy lifestyle can help us to enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventive care. Thank you. Wish you all a healthy life.